Thanks. Yeah, thank you. All right, I'm gonna go ahead and call the meeting to order. I'm hearing a little bit of static out there, so make sure none of your phones are up next to the microphone or whatever. I believe that's what creates the static. That will call or stand for the pledge, followed by a moment of silence. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Roll call.
Commissioner Robbins?
Here.
Commissioner Walter?
Here.
Commissioner Bunnick?
Present.
Commissioner Wessel?
Here.
Commissioner Campbell?
Here, present.
Commissioner Alguier? Here. Chairman Yoder?
Here.
All present.
Thank you. Next up, we'll take approval of board minutes, and I believe we got 3 sets of minutes here to approve. Everybody had a chance to view them on your pink or orange or whatever you want to call it.
I would move that we approve the minutes as presented for our regular session dated June 16th, special session, dated July 9th, and our executive session dated July 14th.
Supported, discussion? Not, all in favor of the motion say aye.
Aye.
All opposed say nay. Carried 7-0. Next up, we have approval of the agenda, and I do have one addition that I'd like to add under communications, BHS Insurance, which I think they're in-house tonight to give us an update on our health insurance. So otherwise, I have nothing else, and with that, I'll take a motion. Commissioner Wessel?
Move to approve the agenda as amended.
Supported, discussion? Not, all in favor of that motion say aye.
Aye.
All opposed say nay. Motion carried 7-0. That we have an agenda. Next up, do we have any commissioners here tonight that have a conflict with items on the agenda? Seeing none, we'll move on to communications with first an update from our interim administrator.
Thank you. I'll keep this pretty brief. Only a couple of topics to update you all tonight. Last week, we had a bid opening for the Leelanau Dam structural health monitoring. This request for proposals was put out in response to a dam inspection that was done last fall by the Spicer Group in anticipation of work that will need to be done at the Leelanau Dam over the next couple of years. We received 2 bids, which included sensors, interpretation of the data, and monitoring over the next 12 months. These will, I anticipate, be heard at a future Leelanau Dam Authority meeting, and they will develop a response and a plan for the dam. We know based on this last report that maintenance and repairs will be needed in the years to come, 1 to 3 years, but the extent and the urgency and the actual repairs and the plan to pay for these repairs is still in development. So we will kind of wait to hear from the Leelanau Dam Authority as they interpret these proposals and make a future plan to present to you. The Brownfield Redevelopment Authority met today, and the big item on the agenda was the Herman Road Affordable Housing Development. I would anticipate that the Board of Commissioners will hear from interested parties or the involved parties in the next 1 to 2 months. I know they have a pretty detailed plan on going to the township and then presenting this to the county. So I would anticipate that they will be on the agenda either in August or September with further details on this development project. One item to bring up with the commissioners this evening is in regards to budget. Last year during budget, union contracts were still in negotiation and wage increases across all employees were not finalized and approved until close to the end of the year. And therefore were not part of the 26 proposed budget that was added at a later time. This year, we know what the increase will be for union employees. And I'm bringing this up to you to put it in your minds that we will ask for consensus on this increase for non-union as well. The reason why I'm bringing it up this evening is because our intention between finance and administration is to present a proposed budget to you that's as accurate as possible. That will include increases for non-union and if there's consensus, increases for union and if there's consensus for non-union as well. The plan is to have the budget books ready to print by August 11th, which is the day of our next executive. So the timing is just a little bit tricky to make sure that we can present an accurate proposal to you. If we do not include a non-union wage increase, the books that are printed would need significant editing and reprinting across all departments and areas in the book, as well as updates to the non-union wage scale. So I'm putting it out there that we are looking for a consensus to go ahead and include that 4% into our budget prep.
I guess I'd just like a consensus from the board here tonight, so they can go ahead and print the books rather than changing everything out in the books. What's the consensus on that as far as non-union personnel? Did they get the same increase or 3% or what's, right now, union personnel will have 4% next year, obviously. So what's the consensus on board here, I guess?
It would seem they should give us the non-union should give us an increase.
Okay, Mr. Wessel?
I believe that standard practice has been that we assign to non-union the same increase as union staff receive. I don't know if that's a policy, but I think it certainly has been practice.
Any other comments, suggestions? Yeah, Bill?
Well, I would say we can't really make that decision by consensus. Now, of course, we require a vote of the board, but I do agree that we should follow our past practice.
Really not set in stone if we just practice that. So that would only make sense, and then that's the number we can start with and work from there when we actually go through the process. So we're not voting on it to make it firm, we're just
Correct. It's
making it
just-
easier to do the paperwork and figure the numbers out.
Get the votes
If that
done.
be the case.
Get it to us, correct. I guess from what I'm gathering now, consensus would be 4%, so incorporate that into the proposed budget.
We will incorporate it and work from there. Thank you.
Any other questions for Mr. Robbins?
Yeah, one question, for you, Ms. Seifert. I think it was last week, I started getting some calls from the employees here, I should say, and I didn't see anything in their weekly update this week, but it was in regards, there was some issues going on with the credit cards, and I got a call Sunday night too, that there was one. Is there any, has that been resolved?
Yes, and I am prepared to speak on that, so thank you for bringing that up. Multiple staff members have spent the last several days reconciling Jim Dyer's credit card that had a freeze placed on it late last week. Just as a result of, since February, so we're looking at 4 months into 5 months of underpayments, overpayments, duplicate payments, credits not applied, or incorrect balances paid when statements were received. This began in February following the departure of Kathy Hardisfeld. Finance would receive handwritten amounts approved by Jim Dyer to pay. These payments would be made either through ACH or staff were directed to partially pay, underpay, and we even found double payments of statements and often without documentation. So it has taken several days to reconcile these 4 into 5 months of statements, gather receipts and invoices, and ensure that the statements are balanced and properly documented as per our credit card use policy, which is 7.12. The payment has been made, the hold's been lifted, and in conversations with the department head that was affected by that, everything has been resolved to the best of my knowledge. And with whatever assurances I can provide, I can assure you that finance and administration have mechanisms in place to ensure that this will not happen again.
Any other questions? Those changes will appear on our late.
Yes,
reports.
as you can see from the late claims that were sent to you this afternoon from finance, the interest from the unpaid balances are itemized for your review.
That Elon services, financial services.
That's correct.
So there's quite a few of those in here.
Yes. One last thing, per our policy, the county does not do any balances forward. We pay balances in full, but that practice had not been followed since the departure of Kathy Hardisfeld. So our finance director is on it, and with the assistance of all of the finance staff as well as the clerk staff, every statement was itemized and documented, and it took several days to track down all of the receipts. And also per policy, we're required to provide receipts because we are a government entity and we provide documentation for every single transaction. So that policy is being followed. Your finance team is sharp and on it and working really diligently. And the issue has been resolved.
Thank you. Any other questions?
All right. Seeing none, we'll move on to our next update, which is from BHS Insurance. And I mean, we got Pat and Lou here to fill us in. So welcome to the table.
Thank you. Can I get started?
Go for it.
All right. Well, I think all the commissioners have a copy of kind of what I'm going to highlight, and just want to bring everybody up to date on where we've been since you guys gave me this approval to kind of carry forward on the mission, and then an update on where our numbers are running, kind of a stewardship report of what BHS has done up to this point, and again, kind of reiterating some recommendations for future consideration for the end of this year and fall and into next year for planned, adjustments and to kind of get our arms around things. So let's just kind of go through. We have the table of contents and then to the Leelanau County Stewardship Report. This is the first page here. I just want to kind of explain a couple of these initiatives that we incorporated and have worked with your staff to kind of get set up and develop. Employee Navigator implementation. That's an online enrollment system that the HR team and administration has access to kind of facilitate enrollment with back and forth with Blue Cross and your other insurance carriers, dental and vision, life insurance, disability, and remove all the paper out of the process. So it's all electronic. And then in the future for open enrollment, the staff will enroll online and be able to make elections and changes digitally. And so that frees up the admin time for, a lot of excess time that they were dealing with paperwork and reconciling bills and those kind of things. So that's all been set up and it's running, and it's in the testing phase with Jennifer and her team. Compliance dashboard is the next item that we kind of set up, and that's a kind of a it's an HR tool basically that puts all your compliance requirements online. So it's a quick reference for any of the administration, HR team, executive group that wants to kind of see, hey, where there's some compliance regarding our administration of our health plan. Are we up to date? And that compliance dashboard will have everything right there for them. So we've got that set up. Springbuck Data Analytics. This is something I talked about when I was encouraging you guys to give us the opportunity to kind of work through, what we want to do, and that is now in place. That's a data analytics software platform that includes AI technology, and we plug right into the Blue Cross claims paying system. And if you remember, our fixed costs are flat, but our claims are what I'm kind of projecting. And in order to adjust those claims and kind of have them come down, we really need to see where they're coming from, how we can affect them. And I'm going to show you an example here of how that software has shown us some information where if we could act on those things that are coming out of the software, we can save the county like $76,000 in just education opportunities, which is kind of a pretty easy softball. So we're pretty excited about that. And so that is now that integration is all up and we have access to that data. Also, we did one-on-one meetings. Lou was here on site during that period of after open enrollment and during the process of, for staff who have claim issues, or I know you worked on some recently. And then also Peggy in my office has taken some calls with the employees to kind of work through HR questions and related to the health plan. So just wanted, that was one of the things that we were committing to. So some additional value added services, just to kind of remind the county commissioners of what we're up to and what we're doing. We are working ongoing with Jennifer and Lauren on different requests as they need them for HR support. It's going very well with our communication, the communication with us and Blue Cross and kind of our intermediary with you guys. Compliance updates, making sure that the compliance information is being proactive. So all that's been happening. Ongoing employee education. We are benchmarking, providing the team benchmarking data so that you can see where our benefits stack up with other counties. And obviously our contributions, there are none, so they're very good. And then we'll be pulling together an annual review of kind of our recommendations and things like that. So that's some of the things that are on our agenda for the back end of this year. We want to continue to use our analytics to kind of bring solutions to the county on how we can continue to save money and maintain really quality, top of class benefits for the staff, for the county employees. And that's our main goal. So we do think we can accomplish both. So just kind of moving along into the claims. This is kind of the bad news that I got to share today. And that's kind of like how we started off the first part of the year, and our plan year, remember, goes from February on. So we're roughly 5 months into this claim reporting process. And we started off with some significant claims. So it's still, I do want to kind of adjust what I'm going to project of where we're coming. I do think it could be still very, very close to what I originally projected, but I do kind of want to say maybe we should plan for a little higher expense, and I'll lay out that number. But these reports are your data. They are the county's data. They're what we pay in fixed costs. We're what we've paid in claims costs through June. So we get those claims information uploaded into our about a month behind. So by the 15th of July, we get June's numbers, and by the 15th of August, we'll have July's numbers. So what's good news is that we are trending in the right direction. And from experience from Lou and his history, and looking back at your prior years, this is kind of has been your trend. And so I'm comfortable with our numbers, but would like to hedge, and because of the initial heavy start, I think there should be some consideration for looking at a budget increase for what we could end up at if we don't do some of these things I'm going to suggest here in a second. Okay, so And I'm welcome to questions. If you guys have questions right now, as I ran through these things, I'd be happy. I know you got a lot on your agenda today, and I just want to kind of move through some of these things, and if there's something that hits a topic, I'd be happy to respond at any point. So this page right here kind of gives you your month-to-month claims, your enrollment by staff, how many staff are involved, that we are considering, that we're looking at our claim activity. You can see what our fixed costs are every month. That's the cost that never changes. So that's how much we're going to spend regardless. That's the insurance. That's the Blue Cross carrying the card. That's our reimbursements from BHS. It's everything that's fixed. The claims is our variable number, and that's the number that varies from month to month, and you can see total claims. And then we also get what's called stop loss reimbursements. So anything over that specific number, if you remember, we moved it up to $50,000. So I'm going to show you a report. We have 5 individuals that are over 50,000. When I presented the budget, I presented it based on that I was comfortable if we had 20 people meet that. So we're well underneath it, but we have 10 individuals in addition to the 5 that are somewhere between $5,000 and $49,000. So what you see here are those claims, and minus some of the reimbursements we're starting to receive to offset that. So you can see in our last month of claims paid at 137,000, we are trending in the right direction, because typically what we find is 20% of your people drive 90% of your cost. And once those people are on claim, they're going to be there. It's off. It's not our liability. So we do expect trends to kind of move up. But I'm kind of saying, hey, based on our expected cost and what I'm looking at today, when you look at the average of 252,000, this is with those really heavy months. If you trend that number, 252,000 over 12 months, that's where I'm going to set your budget number, so to speak. So I'll get back to that one more thing. So again, this is some of the data that I was just mentioning. There's 2 reports that are also in here. The 5 individuals that are over, how much they're over for, and then the total of 15 people who are somewhere between $5,000 and over our 50. And you can see that we've had some significant individuals with some significant spend very early in our plan year. I'm going to pause for a minute just to let everybody take that one in. Okay. I think the next piece that I really want to show you is what I mentioned prior, and that is our data analytics software that allows, that plugs into our claim paying system. This is a snapshot from the screenshot. Jennifer Kane has access to this data. And so this is the report. And I know you got a lot of data, and if there's questions later that you want to email either through Lauren or Jennifer or directly to me, I'm happy to answer any of those questions. But this is the software package that plugs in and it tells us what's going on. And this is the report that shows that we've got basically $76,000 and really correctable guidance with how people are using our healthcare. And we just kind of have to set up a program to kind of have that kind of communication reach out. And I've been talking to Jennifer and Lauren about different ways we can do that. And sometimes BHS gets involved in that. We'll be able to identify or talk to some of the people. We'll be able to do education around some of these topics, you know. And so one of the topics, it's kind of the print small to see, but avoidable ER. Okay, we have 4 individuals that have used the ER for reasons that you probably could seek out care elsewhere. Those 4 individuals are just under 10 grand in expense to the county, because our cost for them to go to the ER is $150, and the county pays everything over that. That's our expense. So if we can do some education with those 4 individuals, or just in general with all staff about where our resources are, that's one source of how we can. That's 9,000 of the 76. So this report is actually 3 pages long. There's a lot of stuff in here. I just gave you the snapshot of it. And so my advice is for the county to consider utilizing what we call direct primary care. And I've been in communication. We do this in West Michigan with a lot of our self-funded clients with Blue Cross. And we can give the direct primary care physicians access to this information so that when staff are in there talking about their healthcare concerns, they can help them, educate them on the best process. So I did want to spend a little time about direct primary care and what that means, because I think it's something that we should consider, if not this fall, but certainly for next plan year. It should be something that we really want to use. And I've seen like 5-to-1 ROI results. So the company that I would recommend for you all to consider is called Table Health. They're out of Traverse City. They're owned by a resident of Leelanau County. And they're making strides in healthcare and kind of trying to change how do we all use it. So the way this works is today everybody can keep their doctors, and I'm not suggesting we're going to change anybody's doctors. But what happens is the county directs and contracts directly with this direct primary care group of physicians, and then the county employees have access to use them at no cost. So it doesn't cost them anything to go there, and it's a different experience because they have a lot less patient load. They have like 30 to 45 minutes for the initial meeting where they talk through their health concerns, what their goals are, and they're able to kind of work through a path. BHS, we offer it to our employees. We're self-funded, we're Blue Cross, and we have a direct primary care solution. We have a virtual and where you can walk into the clinic in Traverse City solution. So our employees that are downtown in Traverse City have the ability to do this. So that's essentially how that works, is that they have access to these physicians at no cost. And so the county employees really love it, because you can deal with things like, you don't have to change your primary care doctor. You don't have to change your kid's pediatrician. But if you want to, and there's something going on that's like on the weekend, or, maybe it's pink eye or a rash, or they're traveling, and they can have that conversation or walk into them. This is an example where we could offer that to staff and they would use it versus using our ER. And we can capitate the rate. And so when we have all these claims, and the more people we can get to use this, that doesn't hit our health plan, that lowers our claim costs. We're also talking about imaging and lab work. That lab work that's done in that office is covered under those capitated rates. So our plan's not getting hit by external lab work or things that might be ordered. They can do it all in place. So Jennifer came down and listened to a seminar that we hosted last week that really went into some more detail around this concept. And, people don't really want to listen to their insurance agent. Me and Lulu's very helpful, but they don't want to listen to us about what they should do with medications and, how there's opportunities, but there's certainly opportunities, because if you look at our spend, our specialty medications are very large. And there's opportunities where those drugs make perfect sense. And there's opportunities where there's other solutions. There's biosimilars, there's different things. It's just evolving very fast, solution. So I put some slides. Yes, sir.
Before you leave this.
Yeah.
We've talked to Lou about meeting with staff. You've done that, or you've tried. Have most of the staff met with you?
We've had several scheduled meetings, and for the most part, I think the best attended meeting, maybe 8 people showed up. A couple of the meetings, no people showed up. So this is something we've been talking about, what kind of a hook we need to find that will get their attention to get them to come to the room. This could be one of them. If they have access 24/7 to physician with no cost to them, maybe they'd want to learn about that. But for the most part, we're still experiencing the same thing we experienced before.
So we're having a number of people that could be saving us money if they would just use generic medicine and not use the ER room if there's other options.
Yeah, there's some things, we have a lot of the information. We get access to a lot of information and, we're always very conscious about people's privacy. But we do want to say, hey, why aren't you taking your diabetic medication? Is there a reason? If I can give it to you for free, and I have a resource to give you this for free. Now, that doesn't become an ER visit and a surgery later. That costs the county $200,000. So that's why these are working. And then we also form other partnership with other independent providers. Somebody's not tied with any one health system for things like, deals on x-rays, MRIs, CT scans, things like that. So that we're doing them outside of a hospital setting and paying less for them. And then the staff can get it for free. So the ideas around it are to create win-wins, make the health plan better for staff, but also save the county money too. So I'm not saying they got to change. I'm just saying there's a better way to do it. And that's kind of where I want to go.
Just to get a sense for it, you say you have a table health office. Is there one doctor there or the 5?
Yeah, they, I think that's a really good idea. They have mental health, they have pediatric, they have women's health. They have specialists and they like to do a really deep dive in your claim information. I've just kind of sent them high level, like top 10 claim, pharmacy issues, top 10 healthcare concerns. But they actually try to position the right doctors with the right group. And they have other employers that are self-funded in the greater, counties here, or surrounding counties in this program, working already with them. So I don't know the total number of doctors. They have a lot of our, PAs as well. So I don't know the whole staff makeup.
But you don't have your primary there. It's augmented.
Yeah, it's your choice, really. I actually did it personally and signed up because I wanted to see what the experience like. And I can see myself switching. I have a really good relationship. I went to college with my doctor. I really like him, but I was like, wow, this relationship's a lot different. And they why haven't you done this? And I'm like, I just haven't got around. Well, can I schedule it for you? And how about if I schedule it over here? Okay. And hey, why don't we take blood today and just double check your cholesterol numbers? All right. So I didn't have to go somewhere else, get scheduled, go in, take my time. It's really nice. It's a different type of healthcare. And there's reasons why it's working because it's pulling claims out of our systems and we have very expensive healthcare systems in our area, that the hospital systems are they do wonderful work, but they are very expensive. And so this is trying to break the norm, and so I'm trying to attack your biggest number, which is your claims. And this is one area to do it. There are others, but this is one area that I want to start with. And then it also leads to pharmacy as well. So there's some slides in here about direct primary care. I don't need to review those, but one of the slides that I think are very helpful is in here where it shows some common things that they will treat. Things like strep throat, ear infections, ankle injuries, sports injuries. These are where people would use this versus happens on the weekend, they get hurt. Where do I go? I go to the ER to see if it's broken, right? Well, they could treat that. And our plan has a $10 office visit copay, has a $150 ER. So even that doctor's visit or urgent care, it's going to cost the county almost $200 and cost that employee $10. This would cost them nothing. It would save the county almost $300-400 just on these little visits. So you can see how this adds up. And if we can avoid care, it's a game changer. So I think it's got to be in our future. So that's why I wanted to bring it up today while I had the time and had you guys in front of you. And I'm also learning how you guys make decisions too. And, because I know we added the 3-tier pharmacy program last year, and that wasn't easy. So, so I want to bring it up for consideration. Lastly, here is my recommendation page, and at the top, I'm kind of like, want to put the number out there. I do think, we're still, we're leaning a little higher towards this top number of $3 million. But I don't think that the original projection of 2,850,000 is not out of question at this point. It's just the way we started. I feel more comfortable on that number, so I don't know, I know budgets were coming. I wanted to get it out there. And just have that number be in consideration. Obviously, this is a variable, like I can't give you an exact number. I can't read the future because it is on what happens with people, right? And that's our when things swing, and we have caps, but this is where I feel pretty comfortable. I'd like the board to consider table health or a direct primary care solution. I also was in communication with Lauren and Jennifer, and thought that broker RFP process was going to be kind of postponed until after this year. We received that RFP. I'm asking the board maybe to consider letting us have a year before that happens, but I'm willing to kind of work with the county if there's something in question that we want to identify. I also would like to kind of throw out there that we should look at offering a second plan for next year as we do planning for this possible health savings account plan that would still be very top of class. Maybe that's a no cost plan and offer some cost share for our current plan. That is the Cadillac of health plans. And if we don't do the direct primary care in this fall, look at how that would incorporate into our plan expense and budget for the next plan year. So those are things that I just would like to kind of throw out for consideration, and then I'm open for questions, and so is them.
Questions, Commissioner Robbins?
We're a few weeks away from going into budget. Last year we went from 20 to 50.
Yeah.
We don't know what the cost is. It changes every day for guys. I mean,
Yeah.
are we at the point where we should be maybe looking at 75 or?
No, not yet. I like the number you're at. We won't know that until we see the numbers, because it's kind of like what the deal on the table is, comes from Blues. And one of the things that Jennifer came down is that she was listening to was a presentation on healthcare captives. Healthcare captives are an alternative to Blue Cross for just the insurance piece. Everybody keeps Blue Cross. It's like changing your engine, going from the diesel to the electric, but your car looks the same. You know what I mean? So she was learning about that, and that's an idea where we can go and we can compete that. So until the insurance cost, that fixed cost becomes unattainable, but at 20,000, we were nowhere there's not a chance we're gonna meet budget. So we had to adjust that to 50, and they were giving us a pretty good premium break to do it. So that's part of our evaluation, is that we're gonna look at that, but we're also gonna look at competing against Blue Cross with other stop loss carriers to be able to drive that down. And that's why when, Lou put you in this model so many years ago, it is the best model, because you have all these different things that you can compete against and not change the plan to the staff. It's just changing the inner workings of the motor, basically, that runs it. So I'm not saying 75 should be there, but at under 100 employees, I do have benchmarking data. You're not out of line. I mean, majority of people under 100 that are self-funded have very low attachments, in that right around 15 is like 16%. And about 45% are, slightly less. So we're right there.
Commissioner Money?
Yeah, on that 76,000, what percentage do you think they can say to, if we get them to participate?
Well, it's all their choice, right? Because I'm going to tell them, here's what you could do, and then they got to decide if they want to do it. There's one of the top corner was 2 people that can convert to generic medications, and it saves $6,000 for the county. So do they want to? They got to talk to their doctor. Are these options? Was it ever presented to them? Did they already try it? Did it not go well? So there's things that come through. So I don't know, but in most cases, when we have somebody who's willing to kind of talk through it, we get a pretty good result, because less money, because our copays now are 40 and the generic is 10. You know, because we changed the copay, so it would save the money. So I can't guarantee it, but I could say right now, it's really hard for them, you know, Pat Dalton or Lou to call them up and say, hey, I want to talk to you about your medication. I'm like, you're my insurance guy, right? So a doctor relationship or a peer is probably where that has to come from. Yes, ma'am.
So if I look for an address for Table Health, will I find it?
Yes, you will. Yep, and there's one in Traverse City and 2 locations. They have 2 locations, like physical locations. They can be on site too. They could be on site at meetings. They could be on site for a doctor to be here for a period of time for people to come in and talk to them. And we have virtual. They can do virtual visits where they can do it over their phone and FaceTime, all again for free, because you're gonna pay to have them to have access. And when I talk pay, it's like maybe, you know, just to get started somewhere around 50 to 100,000, but 100,000 mean we have like 95% participation. Like a lot of people using it. So it's not a big expense when you look at our budget and what I could save if we start curving these claim numbers, it's massive, right?
I just had a question as to if this is in line with the industry and our top 5 folks. The amount paid to the pharmacy just is unbelievably high, or it just leans that way. So like, for instance, one here, $60,000 paid, well, 54,000 went to the pharmacy. 75,000 paid, 68,000 went to the pharmacy.
Yeah.
$60,000 paid, $57,000 went to the pharmacy. Is that just going on everywhere, or is that an anomaly?
No, it's getting worse. The next 5 drugs that are coming out are all over 10,000 a month. So what they're doing is they're replacing old drugs, which they've always done. But what they're replacing them with is not cheaper. It's way more money. And they're claiming better results. Well, one of the things that we would like to see your employees do is get educated another step. They're pretty smart. They know the language, they've learned how insurance works. Pretty good about that, but now we need to show them how to use that.
Yeah, you just have one condition that, I mean, the first condition, the top one on your list, 64 paid at the hospital and physician, 87,000 paid through medical pharmacy.
Right.
So, I mean, the medications are life-saving, you know, some of the medications are life-saving, and that's why they can, life-changing, so.
I get it, but
We didn't,
that percentage of.
Yeah.
It's just all.
The only way that I've ever seen that number get adjusted downward is if you begin to change the relationship of the patient and the doctor. When the patient comes in with good information, the doctors will listen. If they just walk in and they have their 15 minutes, because that's all you get at a doctor, a lot of the stuff never comes up. If it's not discussed, it's not going to get used. So one of the reasons that I brought these guys to you after they got me was because I knew there were tools out there. And in order for me to bring them to you, it would have cost a lot of money. It might have been worth it, but because of their situation, and this is where this RFP thing is kind of burned my saddle, because I thought we'd been given some time to show you guys, not in theory, but in fact, what it can be done with this information. So I would encourage you to take the time to let this work out. Because when he showed me the numbers from the analytics stuff, I was like, whoa, we're better off than I thought we were. I'm telling him, he says we're gonna be up a little higher than expected. I think we're gonna be lower. Because every year, this is following the model. Heavy, 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 less, 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 less. Look at the first 5 months, heavy, less, 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 less. You're winning. Not big yet, but it's possible. So.
So just a quick one, it sounds like an excellent thing we have to explore. It's closed right now, so it's not gonna help ER visits at night, but they have an office in the Commons.
Yeah, I do think they have an access number, but we can work through those. There are pharmacy ideas and solutions too that we can bolt on with the Blue Cross. Again, Jennifer came down and visited. And the other piece, I'm getting in the weeds here, but we have our medical and you have pharmacy piece that Blue Cross has. You can shop that piece. So, and still have Blue Cross. So that's a solution. And there's a lot of transparent pharmacy solutions out there where they evaluate the medication in 8 different buckets. And if the employee is willing to use one of the buckets, like a Mark Cuban source or those kind of things, they get it for free. The county saves the money. So those are the kind of things you can still do and maintain a Blue Cross quality plan. And those are the things, but it takes, if I did that, that's a lot of noise and there's a lot of things. The drug cost doesn't change, it's just who I'm getting it through changes. So there are steps you can take to help a 3 to 5 year plan be manageable for you all and get it going. But, throwing a lot of change at one time is not easy.
When I add up the numbers on these pies, we've spent 1.8 million, is that correct?
Mm-hmm.
And I mean, I think we budgeted 2.6. So you're saying we need to somehow adjust our budget up to about 3 million?
Yeah, my number was 2.8 million 50 is what I gave you guys, but I know 2.6 was discussed. But yeah, I think it should be closer to 3. Like Lou said, I think it could easily hit my original number. But because of your heavy start, I think it's more going to be closer to 3. If we don't get what Lou's experience is seeing.
So, I mean, that's what you're recommending right at this time.
Yes. I mean, I'd rather have a higher number, you guys not be shocked by it and come in underperform,
I
better.
mean, you might be right, but we did it at 2.85. I guess I remember 2.6.
We started it.
I remember 2.8.
All right, any other
Excellent.
closing questions?
Thanks for.
Thank you, guys.
Thank you, that's interesting.
Appreciate it.
Yeah, making the drive and presenting us a lot of information here. Well,
Yeah, I appreciate it. Yeah, I know, it's a lot. If you don't deal with it every day, it is a lot, so. But I just wanted to give a big picture of kind of how it's running, and then we can look over the next few months, and if it continues in that trend, I can re-advise the budget.
Yes.
Okay,
Really appreciate it.
all right,
Thank you.
thank you.
All right, with that, we'll move on to our next update, which is from Lisa with Meals on Wheels.
Thanks so much for having me and us. I'm here with another person from my organization who is my manager. Her name is Taryn Sheffield, and I'll let you tell a bit about yourself.
Hi, I am the new Economic Stability Director with NMCAA.
And of course, I'm with Lena, because last week, Lena made a presentation for Leelanau County Senior Services along with Candy Lannon from Area Agency on Aging. And the 3 of us work very closely together. And years past, the 3 of us have done presentations together because we work so closely, we decided to split it up. So I want Lena right by my side because that's where we usually are. So I want you to imagine, and we're taking a shift here from sort of big picture that we were just hearing about and data. I want you to think of people. I want you to think of people in your life that are seniors, individuals 60 and over. Could be a family member, could be anybody that you think of, wow, you know what, someone could really benefit from Meals on Wheels. And just think of that as we're going through this. I'm going to have information and numbers, but it's all about people. And we always say it's way more than a meal. So I've given this presentation many times, but you have a lot of information you're dealing with. So I want a refresher, and in case someone hasn't heard this before, and then bring it up to date about where we are this year for our program as a whole, and then also specifically Leelanau County. I want to say this year, just like Leelanau County Senior Services and Area Agency did, we're going to be looking at a full year, which was our fiscal year 25, which was October 2024 through September 2025. So just starting with our mission is to improve the health and quality of life of vulnerable, primarily homebound seniors. And we do that by delivering vital nutrition, compassionate visits, and safety checks. And the goal is so it enables seniors to live nourished lives, nourished not just by food, but by companionship and love, with independence and dignity. We know the statistics, as Candy and Lena talked about, that the majority of people really want to stay in their homes, to age in their homes independently. And sometimes Meals on Wheels can be the one thing that they get that can enable them to stay in their home. And we'll talk about this a little bit more, and out of more expensive facilities. So there's a few different sections. And so you have material sitting in front of you, but I'm going to kind of go over this. So the first is food. Food is medicine. So there are 1 in 7 kind of across the country, individuals face food insecurity. And that could mean not having food. That could mean not having enough food. And these are individuals that are primarily homebound. Doesn't mean they're home all the time, but they don't have the ability to get out on a regular basis. They need assistance, or it's taxing for them. If someone is using a cane or a walker and carrying oxygen, it's not safe for them to, even if they do have a car, or maybe they shouldn't drive. Or most people don't have a car or reliable transportation. So those are the individuals. So food is medicine. People can't live without food. So it's a basic necessity. We work very hard to have the meals be delicious and nutritious. Work very hard for them to be nutritious. The Area Agency on Aging has a dietitian who approves all of our monthly menus. There's state guidelines. We work very hard to have nutritional goals, which we track. Things like lower sodium and not too many carbs for individuals that are diabetic or anybody. Each meal is a protein, 2 vegetables, fruit, milk, bread. 1 vegetable is starch, 1 vegetable is not, things of that sort. But we also make them delicious. Who cares how healthy they are if they're not delicious? So we work very hard. I always say that our kitchens have love as the main ingredient. They care very deeply for what they're doing. And we take client satisfaction very seriously. So we ask people what they like, what they don't like, things of that sort, and then we tabulate that information. And I work at the kitchen to do the monthly menu, and it's very time consuming because, like, oh yes, we've heard, we trended. Oh yes, people are saying we don't like that. And then we work with the kitchen. Why is roast beef not the most popular thing it used to be? Well, maybe they changed the product or they changed how they're preparing. So we're continually trying to improve it and make it delicious as well as nutritious. The second thing is, so once they prepare the food, then the people to deliver. And this is the more than a meal. So we come in, and our drivers are the most amazing people you'd ever meet in your entire life. We just attract people who love what they're doing and they want to make a difference in people's lives. And so the first thing we do is come and make sure they're alive and well. They're doing okay. So it's a safety check. We never leave the meals if they're not there. And that's so that we can make sure the person's okay and the food is okay, but most likely so the person's okay. Oftentimes we've seen someone who like, are you doing okay? You don't seem so good, because we get to know people and we may pick up on something that they don't even realize that how they're feeling. We've called 911. I work in healthcare for many years. And I thought, well, this is food. It's not the same. We had code blues all the time when I worked in the hospital, but it's more than that. Sometimes we're the only people they may see for that day or days at a time. And we have called 911 on many occasions. And sometimes it sounds kind of hyperbolic, but saved people's lives because they wouldn't have seen us otherwise. We've had people, we called 911, we call emergency contact. a daughter came and maybe spent time with their loved one, and they wouldn't have been able to see them before they passed away. And then it's deeper than that. So the independence and dignity is the way more than a meal. We have an individual that does assessments, part of the program, after they've been getting the meals for 2 weeks and then every 6 months to talk about client satisfaction and get all that feedback that we were talking about, but also take a deeper dive into an individual and connect them with other resources, and then have our eyes and ears open for individuals that we might really be worried about. Lena and I were talking about an individual the other day that's a Leelanau County person, and we were very worried about the person. And so we get very involved in adult protective services, and they're very collaborative with us. And we call the 1-800 number, and then we have on speed dial, the director. And we said, we are really worried about this person. And this was on a Friday, and they had the person on call, open the case immediately. And we got a call on Sunday that they've started to work on it. And so this is the way more than a meal, just to make sure everybody is not only fed and loved and cared about, but safe and able to stay in their home. So on the bottom of this first sheet, there's a graphic, and it talks about the cost of a year of Meals on Wheels is equal to 6 days in a nursing home or 1 day in the hospital. And that's because, as I mentioned, just having these services is sometimes the main thing that people need to be able to stay in their home and out. Not only do they want to be there, but it's a good investment for you, to the investment that you make from your millage dollars and Meals on Wheels, because it keeps people out of more expensive nursing homes and hospitals. So it's a very good investment. Any questions so far? The next page, just a little bit of statistics about regionally, we cover 4 counties: Grand Traverse, Leelanau, Wexford, and Missaukee. What about the numbers of clients, things of that sort, and eligibility? I mentioned over 60, primarily homebound, don't get out very much. There's not a charge. Part of 30% of our funding comes from the federal and state government. Part of that comes with a book of 125 pages of regulations. And one of those is beautiful, and it says that no one should, money should not be involved when we're talking about food. And so no one is required to pay, but we're required to give people the opportunity to pay. So every month they get a letter. It's not a bill, it's not a statement. It's a letter that says, this is how many meals you received. The suggested voluntary donation is $4 a meal, but no one is required to pay. The cost, as you can imagine, is more like $8.50, $8 to $8.50. And, but people don't have to pay anything, because we don't want money to be a reason why people get food. And it's amazing. We receive about $200,000. It's all voluntary, because people feel good being able to contribute what they can. And sometimes people can't. And then the rest of the 70% we have to raise through other resources like the counties. Other counties that we don't serve, if we did not operate Meals on Wheels and you guys did, you would probably be spending about $300,000 or more to operate your own Meals on Wheels. But your investment in Meals on Wheels is $75,000, which is, there's no way we could do this without it. And it's a very important investment in Leelanau County. I'm going to say a little story, and then we'll talk about statistics for Leelanau County. And it's kind of timeless, because we see this happen all the time. It's called waiting for daylight. I knocked once more, and this time a little louder. There was still no answer. I walked around to the side door and knocked again. This door was unlocked. I opened it and called her name. The voice I heard was faint. I went in and found Sarah, which is someone that you could probably imagine if you were keeping someone in mind that you know. I found her on the floor of the bedroom. She'd fallen in the night and was unable to reach her phone. Sarah told me that she wasn't hurt, just unable to get up. I called for assistance and waited with her until they arrived. She told me that what kept her calm was watching and waiting for daylight, because once it was light, I knew it wouldn't be long before you got here. And we develop relationships that are like family. They have a button. We always make sure people have buttons that they can call, but oftentimes they don't want to. They just want to wait for us. And so they can not be alone. The next page is Leelanau County specific statistics. So for congregate meals, we now have 2 congregate sites, thanks to the collaboration with Lena and her staff. And so Sutton's Bay on Fridays and then Maple City on Thursdays. It started in August of 2025. And over the winter, it was a little bit slow, but now it's really picked up and sometimes they're about the same. So it's still, it's growing, but it's pretty amazing. So Lena really looked at what's a part of the county that she thought would really enjoy this and could benefit from it. So that's why we picked that location. We said, okay, we'll bring meals there. And then it's very much of a collaborative process between us. And we collaborate on all these things, not just millage, but referring clients. Lena just mentioned to me as I sat down and said, thank you so much for that quick referral. She referred a client and we were able to get them started right away.
We referred, I think, on Thursday last week, and he will have meals this week. So this particular individual was falling while cooking meals, and he was finding it more and more difficult to make his meals. So he chose to only have 3 meals a week so he can keep his level of independence on cooking meals, but it's a safe, it's an outlet and a safe opportunity he has to still be able to get the nutrition he needs.
So, so that was a little bit about congregate meals, and we've seen a significant growth from last year. And then with home delivered meals, we cover every part of Leelanau County, every inch of it, 285 miles. We used to have 2 routes. We now have 6 because of the numbers have increased and because of the mileage that we're covering and things of that sort. And we tailor it very much to the individual in terms of the number of meals. Traditional would be of the 1 meal a day, main meal of the day. We deliver once a week. So people can schedule their appointments around it. We make them fresh and deliver them frozen. But if someone needs a meal, we always say, is that okay? Or do you need meals today or tomorrow? And we'll bring them meals even, before their normal route. So it's very tailored to the individual. What questions might you have?
Any questions?
Could you explain the Grand Traverse Band contract?
Yes, so the Grand Traverse Band reached out to us in 2024, and they were in the process of looking at their kitchen and trying to get it up to speed. And so they asked us if we could provide meals instead of them for a period of time. And so they paid us. So the millage that you pay, the numbers that I have here for individuals 60 and over, we receive a certain amount of money, like I said, from the area agency, but it only covers 30% of our budget, 30% of our clients, et cetera. But that is what your millage supplements. But then in addition to that, we have other contracts for other individuals. And so for congregate, that included the Grand Traverse Band, because that was like a congregate setting where people could get out and things of that sort. So we contracted with them in 2024 and then 2025, and then they started doing their own meals. On home delivered meals, same thing. So your millage only goes to home delivered meals. And so for home delivered meals, it's 60 and over. Again, it supplements the funding that we get from the area agency. And then the other place that we have a contract with is Pace North. So we had 136 people in FY24 and 723 in FY25. So it's a wonderful way that can supplement all the funding that we have to be able to serve people. Yeah.
Any other questions?
I want to thank you. This is very, very important. And it's really important for elderly people to know they can have nutritious meals and stay at home and have a friend. So thank you.
And if there's anybody please send them our way. Funding is always a challenge. That's why your investment in Meals on Wheels is so important. But I always say that we want to get the word out and have as many people as possible receive our meals. And then on the other hand, do lots of fundraising outside of it so we can make sure we can always be there when people need us most. I would like to point out, so Gwen, we're so grateful. Gwen is on our NMCA board, and then also Sam Gessinger as well. So I'm very grateful for all of you and your support of Meals on Wheels.
So if you know someone who you think this would benefit, just have them call that number.
Yep, exactly. Yep,
3780.
that's it, exactly. And it'll say for Meals on Wheels, press 1, we're the first one. Yeah. And we have someone that mans those calls all the time. And then we'll get asked questions. We do what we call an intake, and we'll get them set up and get them meals as soon as they need them.
Thank you.
Thank you so much.
Thank you. Appreciate you welcome to come present.
Thank you.
All right, with that, we'll move on to our first public comment, and we'll start out with 1 minute of any topic you wish to address the board with. Wait.
Good evening, Commissioners. My name is Jim White from Sutton's Bay, and I would like to briefly recognize an important public document that was made available to me today. In a July 14th letter to Finance Director Rio Risbridger, this county's outside counsel concluded their investigation of her whistleblower complaint and supported certain of the concerns she had raised and identified additional operational, communication, governance, and employee relations concerns, and stated that those concerns presented risk to this county. The letter notes certain identified concerns were also promptly addressed, reducing that risk. The timing noted by the county's legal counsel is encouraging. Mr. Dyer was placed on administrative leave on June 9th, and since then, interim administrator Lauren Cipher, working closely with Finance Director Rio Risbridger and other county staff, has been leading day-to-day operations. While the letter does not identify who implemented the corrective actions, many of those improvements appear to have occurred during Ms. Cipher's interim administration, and I feel that is an encouraging sign. Rather than dwelling on or rehashing old divisions and regretting past toxic environments, let's continue supporting the collaborative leadership which has already begun reducing risk, restoring stability, and rebuilding confidence in our county government. Our employees and residents deserve nothing less. Thank you.
Anybody else wish to address the 1 minute? Yes. All right, and then we'll do agenda specific now, so go ahead, 3 minutes.
Tamara Kiesel, Leland Township. I am just here to point out some hypocrisy. Okay, I said I'm here to point out some hypocrisy and make public a problem that is absolutely unacceptable for county government, specifically county finances, and make sure that it does not get swept under the rug. My husband is the undersheriff, and one of his many responsibilities is keeping the sheriff's office budget in check. One of the ways this is done is through the use of a credit card that is issued in his name through the sheriff's office. This card was applied for using his name and his social security number because apparently that is the current law or county policy dictates that. Not because this is a requirement of his position, but because in doing it, the sheriff's office is in a better position to interact in today's world. These purchases are always in accordance with the rules within the previously approved county budgets so that the money should never be a problem. This credit card is issued or used by my husband for sheriff's office purposes and various reasons, including securing hotel rooms for employee travel and paying for educational trainings. As I've learned, he makes the authorized purchases using the card, usually because there's no other feasible method of payment. He then accounts for every purchase with individual receipts, which are then attached to the monthly statement and submitted, usually hand delivered to the finance department. This has happened for the last several years. Once again, this past June. However, for the June statement, he submitted June 10th. The sheriff's office credit card was never paid. Actually, as of this morning, the outstanding balance that was due July 7th still has not been paid. As I understand it, the county has now been assessed a late fee and also charged interest. Again, this card is in his name. So this late payment will now presumably affect his personal credit and our personal financial standing, something that should never be at stake when acting in good faith for his employer or anyone's. The fact that this has happened should make every citizen of the county and everyone on this board embarrassed. I know I am. I also find this ironic, and this is where the hypocrisy I stated above comes into play. The individual ultimately responsible for making this payment has been too busy formulating a 13-page letter detailing all of her bosses, the administrator's shortcomings, all while neglecting her own job duties. This problem is unacceptable and needs to be rectified immediately. Not that his credit can be restored or damaged reversed. Thank you.
Any other public comment? Yes, Ms. Shastich.
Good evening, Commissioners. I'm Steve Tostich from Solon Township. I'd like to respectfully offer two thoughts as the county moves forward. First, I encourage every commissioner to give Interim Administrator Lawrence Seifer and Finance Director Rio Risberger a fair opportunity to succeed. The past 16 months have been difficult for our county. We have experienced investigations, employee turnover, public controversy, and declining confidence. Regardless of how any of us view the past, I hope we can agree that stability and cooperation are now in everyone's best interest. Lauren and Rio stepped up into challenging positions. They deserve to be judged on their work, their professionalism, and the results they achieve, not on speculation or assumption made only weeks into their tenure. That does not mean they should be free from accountability. It means they deserve the same fair opportunity that any new administrator or department head should receive. My second suggestion is one that can benefit the county long after the current situation is resolved. I encourage the board to establish a formal process evaluating each county administrator, beginning with the current interim administrator and continuing with every future administrator. Set clear expectations, measure objective results, review progress on a regular schedule. Those measurements might include timely financial reporting, successful audit completion, employee retention, implementation of board priorities, collaboration with elected officials and department heads. When expectations are clear and performance is measured objectively, everyone benefits. The administrator knows what success looks like. The board has meaningful information on which to base decisions. Employees understand priorities. Most importantly, the public can have greater confidence that evaluations are based on facts rather than personalities or politics. Finally, if the board reaches a decision regarding the county administrator this evening or in the coming days, I respectfully ask that you share with the public as much information as the law allows. While currently client communications is a confidential matter and must remain protected, taxpayer funded these investigations because the confidence in the county government has been shaken. The public deserves to understand the reasons for the board's actions and the steps being taken to ensure these issues do not recur. Transparency is an important part of rebuilding the trust. The county has an opportunity to begin a new chapter. Let's support talented public servants, measure performance objectively, encourage collaboration, and make Leelanau County a place where good employees want to build their careers. If we do that, everyone, employees, elected officials, and the public will benefit. Thank you.
Any other public comment? All right. Being none, we'll move on to commissioner comments. Mr. Robbins?
I apologize, last Tuesday, I forgot to mention that, I guess about a week ago, former administrator Dave Gill passed away. And he had a lot to do with this building, and had a lot to do for this county. And from what I think Mark maybe back me up, I think the service is like August 1st in home. So just our prayers and thoughts to his family.
Any other commissioner comments? Commissioner Campbell?
I'd like to use my time to clarify a published statement made by our unofficial county administrator who has been placed on leave. He is quoted as saying, "There have been some proposals from some parties as to how we might manage a return." Please allow me to provide facts pertaining to this statement. This county board has not authorized any proposals that might contemplate Mr. Dyer to manage a return to his position with Leelanau County. I do not know what parties he is referring to, but they have no authority to speak on behalf of the Board of Commissioners. Mr. Dyer knows that. We as a board, along with our attorney, took the resignation letter of our former finance clerk and the whistleblower complaint filed by our finance director very seriously. I have read media accounts that have given credence to a number of unrelated accusations that cannot be substantiated. They read like soap operas, and they have no bearing on the reasons for our decisions to take action to remove our administrator from a position of authority within county government. One of the statements from our former finance clerk, ultimately, the administrator's disregard for the stability of the finance department created a level of operational risk I could no longer facilitate. It goes on and gets worse. Following is a whistleblower statement. I am presenting these concerns directly to the Board of Commissioners as a public body regarding suspected violations of regulations and the severe misuse of public funds. We received a third letter from our former assistant finance director that offers a similar glimpse. The investigations have been concluded, and I cannot comment on them because of their status as attorney-client privilege. However, if the public and media were interested in versions of findings, the county board authorized the finance director to be provided a written synopsis. As the county attorney did not represent this individual, it's my reading of the Freedom of Information Act that the letter could be released through FOIA. I hope so. Also, and adding to the void of meaningful communication, time restrictions in laws designed to protect certain classes of employees have drawn out the process. Unfortunately, these restrictions and delays have resulted in rumor and speculation over which we as commissioners have limited ability to counter. In the meantime, I would like to reaffirm to residents that Mr. Dyer was not placed on leave due to an unsubstantiated and unproven meeting or a conversation in a hallway that lacks evidentiary proof as to its contents. Both events supposedly occurred more than a half a year ago. I can assure that they have no bearing on my decisions. Our actions have been taken due to more recent and serious written documents about the conduct of the administrator. Sidestepping or downplaying them would be to neglect the responsibility of our elected offices. Thank you for bearing through that.
Any other commissioner comments? All right, seeing none, we'll move on to our consent agenda items, and I'll just read a quick statement here. Purpose of the consent agenda is to expedite business by grouping non-controversial items together, dealt with by one motion without discussion. Any commissioner may ask that any item on the consent agenda be removed and placed elsewhere on the agenda for full discussion. Such requests will be automatically respected and will not need a second. Mr. Money?
Yeah, I'd like to remove item number 2, the purchase of the vehicle for the lease. And then maybe put that under 1, where versus sheriff's office, and make it like 1B.
Okay. I want a 1A.
Sure.
1A, yeah, one action item. Anybody else wish to move anything off the consent agenda? Mr. Wessel?
Move to approve the consent agenda as amended.
Second.
Moved and supported. Roll call.
Commissioner Wessel,
Yes.
Chairman Yoder,
Yes.
Commissioner Elguer,
Yes.
Commissioner Bunnick,
Yes.
Commissioner Campbell,
Yes.
Commissioner Robbins,
Yes.
Commissioner Walter,
Yes.
7-0.
Thank you. With that, we'll move on to action item number 1, which is the sheriff's office. And I believe we got individuals here to address that.
Good evening. So moved forward from the last meeting Tuesday was the proposal from our inmate food service company, Tiggs Canteen Service, to increase the cost per meal for inmate meals. I have been in contact with them. As I spoke to before, they were looking anywhere between a 30 to 32% increase per meal. I proposed a 15% increase. Their reply was, we're losing money. We've lost $25,000 this year. Products have gone up. We struggled to get staff, et cetera, et cetera. I returned an email to them asking for their current meal pricing versus what the actual cost per meal is. The specific increases in food and product costs contributing to the adjustment. Labor cost impacts directly attributable to our account and any other factors unique to this contract that have resulted in the reported loss. So just looking for a little bit of facts to try to back up their claim of loss. As of right now, I have not received a reply back to that email. At Commissioner Robbins' request, I did reach out to Grand Traverse County Sheriff to inquire about increasing housing costs for their boarded inmates from $35 to $40 a day. He got back with me right away and said they were not interested. They're boarding other places for $35 a day. So if we wanted to do 40, we probably would have no inmates. So that was their reply to that request. So at this point, I guess my recommendation would be maybe to push this to August. Wait till I can get some more information back from Tiggs Canteen and see if they're willing to work with us on the 30%.
He also had additional conversations with Grand Traverse about their current contract, which they are currently in a 1 year. And it's not really apples to apples because, I mean, their jail is far larger than ours and they pump out far more meals on a day than we do. The only comparison you can really make are in the specialty things, such as, you know, the kosher meals, the medical snacks and that thing. And I can say that those prices are comparable. Obviously, we're on a sliding scale. It all depends on population. One thing of note that I did take from earlier is even on the highest end of the sliding scale, these meals are cheaper than apparently what it costs of Meals on Wheels to make their meals.
I guess if I were to make a recommendation, it'd probably be wise to push it to August and just come back.
Need a motion for that?
I don't know if we need a motion for that. It just, if they have something, we'll have it on the agenda for August that I can approve. On the agenda.
That'll be my plan. Thank you.
But Lieutenant Roush?
Yes, sir.
While we can't compare prices, and I understand what you're saying, Under Sheriff Tiso, they're under a 1 year contract, and I assume it's a calendar year contract.
Oh, I have a copy, but they're under a one, they just did a 1 year contract extension with Grand Traverse County.
Expires at the end of this year.
Yeah, January 1 of 2027.
Yeah, so the one thing that is comparable is the food costs that we're both undergoing
Correct.
mid-year, and they're looking for a mid-year change from us.
Correct.
Apparently, they aren't looking for that for Grand Traverse County.
No, and their increased, their requested increase to Grand Traverse County at the start of this year was about 3.5%.
And once again, the closest thing we can do, if you look at that sliding scale on our high end, 100 to 120 meals a day is 338 is what they're asking for. For Grand Traverse, I believe theirs, which 100 meals for them is on the low end of the scale. And yes, it was cheaper, but you're talking 30, 35 cents a meal difference. So it's hard to compare the two, but in my looking at the numbers, it seems reasonable, at least comparative, if you will, given the two different circumstances.
Commissioner Robbins?
Lieutenant Roach, thanks for following up on that. We're caught between a rock and a hard spot here. I talked to Sheriff Shea too. The issue they have down there, they have numbers, so they get their meals cheaper. We don't have the numbers up here, probably never will. Filling that jail is not gonna and make our food bill cheaper, but it's gonna drive the cost up somewhere else, so. We're just, it's the price of doing business up here in this county, that have a lot of inmates, but I really appreciate, taking the time following up.
You were welcome.
Any other questions? All right, none. Thank you, gentlemen.
Thank you.
Appreciate you coming to present, so.
I'm
Please,
I'm
yeah, 1A.
1A now.
Yeah.
I didn't really bring that paperwork, nor was I prepared, but as a recap, in June, I believe it was, we had an employee get in a accident that totaled the vehicle. Like I said, the bottom line for me is it puts me short. We are behind in rolling out new vehicles. And unfortunately, that was the second totaled patrol car of the year, of which the replacements are, I can tell you they're in Grand Traverse County, but they're not ready. Because I've experienced some growing pains with the new vendor. Ideally, I should have one yet this week, but there are still problems with that. My bottom line is I need cars to maintain our professional services, hence why I made the ask. How that ask is hopefully fulfilled is unfortunately your burden, not mine. I'm just looking for the ask, so.
Mike?
Yeah, I would move that the county purchase a new Ford vehicle for the amount, I'd say $50,000 for the sheriff's office, with the money to come from the motor pool fund number 661, which has a current balance of approximately $813,000, $842.66.
Support for that?
I'll support it so we can discuss the numbers,
Yes.
So to speak to that as well as I can, the number presented, 50,000, should purchase the car. It will not be enough to cover installation, upfitting and installation costs, if you will. Not to mention most, but not all of the equipment was salvageable and reusable. Plus there have been some minor changes from that model year of 2020 to the 2026. If I had to wager a educated guess on total costs, I would say total cost for upfitting and remainder of equipment would be conservatively probably more like 65. Just for your knowledge.
6,500 or 65,000?
65,000 car and upfitting.
So I recall you saying that it was difficult to get cars after the first of the year. So help me understand, you've been working with Fleet.
Yep.
And they're readying some cars for you. And what this motion is we're gonna start all over and look for a car. And
Correct.
so this is gonna delay it.
So the budget year originally, the original ask was 4 vehicles. Those vehicles were ordered. They arrived approximately 6 weeks ago, at least in Grand Traverse County. They're sitting at one of our vendors. In March or April is when we had the first car deer actually that totaled the vehicle. At that point, you graciously approved purchase of a replacement for that one. That one was ordered through Fleet and is now on site about 2 weeks ago. The problem has been, well, equipment, and because we didn't know when the cars would get here, the vendor just can't clear 3, 4, 6 weeks to change over 6 cars. They maintain their business, and when they can be put on the calendar, obviously they can clear out a week and get a car done. Not knowing when they were going to arrive, they weren't able to do that. So these cars were drop shipped. They have cleared their schedule as best they can, but we're not their only client.
But we're saying if we're gonna buy one, we're not gonna use those, we're gonna start all over and look for a car?
No, we will use those, so we.
We will use those.
5.
This would just be an additional one on top of that. The one that was totaled out 6 weeks ago was not in the plan to be replaced.
But we're not gonna use one of the ones that Fleet ordered for us.
Yes, we are.
You
So
wanna,
we will have 5 additional vehicles under our fleet management lease program. But the motion that's on the floor is to purchase so that we would have the asset, we would own the asset. So you have to think of it as a second process. If the motion carries. We will purchase the vehicle at the contracted price via my deal. The
Which-
car will be ordered.
Yeah.
And then the car will be delivered for upfitting, but it will be an asset owned by the county, not leased by the county. So
But it's not gonna be one of the ones that are sitting in the lot, ready.
No, it would be, it would be an additional one. Now, one point I would point out
Wait for it.
is,
So this is gonna take long.
When-
Well, 6 of one, half dozen of the other, there's still gotta wait for it. We got the 4 that we ordered. This is an
actually, we have
additional
5. And I will say this, specifically to your point. One thing that the Fleet Management Service promised is because they purchase and order in bulk, they get priority with Ford. If this motion passes and I go through the steps I used to do 25 and prior, essentially, we use the same dealer, we use the same rep. But me ordering one car versus them ordering ours, Antrum's, Emmett's, may take a while. I mean, either way, I don't anticipate this car is back on the road till probably October at the earliest.
Mr. Robinson.
So
There are 4 sitting.
we have, I think,
But-
the cars that we have in are probably sitting on cash, so I take it.
They're out.
Okay.
Yeah.
Okay, but wait, so we got 5 in?
Yes.
When do you think we'll be getting the first one of that?
On the road and ready?
Yeah.
Ideally by Friday.
By Friday?
Yes.
Okay. So why would we go try to piecemeal? I'm not saying I agree with the lease one way or another.
Yep.
But we're piecemealing it and it's gonna cause a mess for our finance department, you and everything. Okay, you got 5 in, you got 1 coming in Friday. Why would we go buy one outright and we don't get it till October? You know,
Well, once again, the 4 I asked for, the 4 that have been, were asked for originally in last year's budget are old, tired, and to the point of costing the county more money and probably borderline not ready for patrol use. The 5th one and the 6th one were not part of those 4. They were part of the fleet that was gonna remain through this year, through next year, potentially into the following year. So either way, I will need to replace it sooner rather than later. Unfortunately, instead of needing 4 at this point, we're to the point where we need 6. And we can't unfortunately predict the accidents. They're unfortunate. I said, this is a bad year. I don't ever recall a year where we've had 2. Usually it's 1 every other or 3rd year, but this year we had 2.
so who is this car actually short? One of our troops that are working on the road every day or administrator?
When it comes right down to it, it's an administrator.
Right.
Yes.
So our first goal is to take care of the troops, making
Well,
sure.
100%. And that's where that's where the other 5 go. So waiting on it is not, it can, if we don't get the car regardless of the situation till October, I can handle it. I can manage that and make it happen. It just will need to be replaced sooner rather than later.
Right.
The wait is not a big deal.
Mr. Wessel.
Yeah, on last Tuesday, we voted 7-0 to go ahead with this, so I'd be interested in Commissioner Bunnick's change, why he's decided we need to buy instead of lease.
But that was why I talked, I mean, when Rio presented, she said it's much easier and cheaper, she believes, to buy them than it was to lease them. And actually, when I read the motion, I was thinking we were gonna buy it. But it did, and then when I read through it again, I was looking at the way it was worded, it was for leasing. So that's why I was trying to do what we were being recommended by our finance director. And listening to the different things that they were stated is that leasing police cars or sheriff's cars is not, we're not gonna make money, it's gonna cost more. Just because of all the outfitting and all the things they have to take off. And Traverse City and the other places are not leasing their sheriff's or police or deputy cars.
Pursuit vehicles.
Yes, they are leasing cars, but they're not. So I'm trying to do what our finance director recommended. And that's why I brought it back. And I know it's gonna take time, you know, but I do believe if we want to do what's most reasonable, then I think that we need to go back to look at that lease and try to, and try to follow what's the best for the county. So I think doing this was my reason. I believe this is what's best for the county.
All right. You had your, Mr. Campbell.
Yeah, we got this information last week, and I was part of the problem, because I heard what happened, and I immediately went to, okay, we've got long-term and short-term problems that we're faced with. We can take care of the short-term, just lease, and the long-term is more of a decision on whether to lease or buy. And then I went back and really spent some time with what we had been given as a guide last week in our packet. And what it shows is the cost to lease comes to $68,666. The cost to buy comes to $57,879. I mean, I got this, I asked for real for this. I did ask that question, is this your recommendation? She says, I don't give recommendations. I give you the numbers. You guys make the decision.
Right.
And so that's where we're at. We're gonna get a car one way or the other. There is a little bit of question on time, but the big question is, how are we going to buy it or finance it? Are we gonna lease it or are we gonna buy it? That's the question before us. According to the numbers that we have been given, there is about an $11,000 difference over the life of that car. So I separated it, made it pretty simple without really looking into the financing part of it. Now that I look at the financing part of it, I would rather buy than lease.
And I do not sit here to speak on the finance director's behalf. She is the number person. I have been in enough meetings, and I mean, the last 4 years, Enterprise was knocking on my door, and it went through several administrators before we got to this point. In the short term, Enterprise was absolutely the answer. I mean, part of this reason we went this route this year, there were other budgetary issues. And instead of spending $280,000 on 4 cars at the time, we got out of the situation for 60. We saved roughly $200,000 this year that we could put probably towards healthcare. I don't know where it went. But as you draw out the year, and if we pay $60,000 for the cars this year and $60,000 for these cars next year, plus new cars next year, come year 5, I don't know if we're in the same boat, if it's equal, if it's less. So I don't offer opinions either. I don't offer recommendations. Like I said, my bottom line is I want safe, reliable vehicles for my employees, of which, even though this current car is an administrator, it is still used in an emergency purpose at times, so.
Walter, and then.
So my question is, why is it the administrator is it a pursuit vehicle? I mean, other counties sheriffs drive a car that's not a pursuit vehicle, they're not going on patrol. And if they go on patrol and they get a situation where somebody's gotta be transported, they're not gonna transport them anyway. They're gonna call for another deputy to do it. It's kind of like having a motorcycle. We have a motorcycle patrol. If they make a stop, somebody's gotta be arrested, they sit here until the car comes and takes that guy.
I
So
appreciate and understand the
don't
question.
Understand why we would spend the extra money for administrators to have pursuit vehicles when I have deputies to take care of that situation.
And as much as I appreciate the answer, we all know who that administrator is. It's the sheriff, and that's an operational question that is above my pay grade, sir.
But it's not above ours.
Sorry, but you're asking the wrong guy.
For your charity, that's something, that that's a decision we should be making.
And
it doesn't make sense to spend an extra $12,000 on a car for a guy who's not.
once again, I appreciate that point. You guys handle the money. Operational, that is his call, and I refrain from answering, if you will. I'll plead the fifth.
I don't blame you.
You know, we reviewed this whole issue very thoroughly. And I'm very uncomfortable just doing gosh, the numbers tonight just don't look right, so let's do something different. We were careful when we made this switch, and we did it for a reason. So I'm very, very uncomfortable with making jumpstart decisions based on one circumstance.
Commissioner Robinson, all of my thoughts.
I think the key issue here is how we get a car for these guys. In defense of the sheriff, it's his department. I don't care if he wants all the bells and whistles on his car, it's his choice. You know, a few years, we may have a new sheriff, may go a whole different direction, may just drive a Tahoe unmarked. I don't know, it changes every sheriff. So this is the sheriff we have, this is his plan, so this is the plan we gotta stick with. So what we gotta do is to, figure out how we're gonna get your car.
So just to offer, I believe what Commissioner Bunny's referred to is the page that was given to us a week ago, and I had done some study on that as well, and I guess from what it looks like on here is the buy versus lease option. If we go the lease option and they do the maintenance part of it, is where we actually lose a lot of money. But if the county if we do the maintenance part, it's almost a wash. I mean, we lose about $224 based on the calculations from the finance department. So, yeah, it's kind of like Commissioner Walters always says, half a dozen, one or the other, you know. So it's like, but I do think if we do lease, then it's something that we have to take care of maintenance in order to incur that cost, where we don't create an undue burden on that. So, so yeah, I don't really have a strong opinion one way or the other. If I guess the question would be, if we do lease, would that car come quicker versus if we purchased? Do you know that for sure? No.
It's
I mean,
my,
right now
it's my belief that it would, yes, because they have far stronger purchasing power. They get cars all the time. I mean, when patrol cars are made, whether it's an unmarked or not, if it's a pursuit vehicle, I mean, Ford shuts down that line and they make them specifically. Whether or not Enterprise orders enough at a time to make that happen on demand, I can't say. On the secondary point for maintenance, that has been a discussion with several meetings involving the administrator and the finance director. And our belief, well, it doesn't look at this point like we're going to go with the enterprise maintenance program. It's my belief. We cannot get local buy-in from our vendors here in the county. It's not worth it to them. So as much as there are a lot of vendors, they say within 25 miles, that's like 25 miles from the county line, not 25 miles from here. So unless we plan on spending a lot of time in Grand Traverse County, I don't think we're going to go that way, because none of the vendors that we use currently, Suns Bay, Leland, they're not jumping on board. So we're probably not going to go with the program.
Well, and to my point on the whole maintenance part of it too, I believe in, as a board here, I want to support our local business as much as possible. And so that's why I would believe that as a county, we should focus on not doing the maintenance option that the enterprise provides, just because I believe in supporting a lot of our local mom and pop shops in the county here, that there's just too much bureaucracy for them to work with, you know. So
right.
There's a way to make it work.
And once again, I think the lease was a viable option, short term, from my perspective, looking at the numbers. Year 1, year 2, 3, and 4. Yeah, I think it's good. It freed up money that we didn't necessarily have. But once you get to year 5, I can't say it's going to be beneficial. But for year 1, it absolutely was. It helped put at least a little Band-Aid on some of the budgetary concerns that you guys had as the board. It saved easily $200,000 from my request of what we paid.
Right. Well, and based on the numbers that I'm seeing right here, if we buy after year 5, we would potentially, I mean, and this is coming from finance, is potentially make a profit of about 10,500, you know, based off of purchase versus lease. But, you know, a lot of that, from talking with the finance director, a lot of that's still unknown, you know, because we haven't been in it 5 years to actually know, you know, so it's a lot of unknowns.
We haven't even really officially got off the ground.
I agree. I agree. So, Mr. Money, you had another.
Well, I was gonna amend the motion so it would include he wanted to have it up this 65,000 so that it would cover all the changeover. So I would amend that, the amount to, and actually, the thing says 57, so I'm gonna go between, say, 60,000 rather than 50.
Okay.
If that would be okay with the second.
Second.
It's fine with me. Yeah, that was what I seconded. I said, just to talk about the number.
Right.
Is it gonna be enough? I mean, I don't-
Well, if it was a brand new car from the ground up, no. Given that a good majority of the equipment we were able to salvage, the tear out has happened. That was covered under the insurance claim. A lot of the equipment, some of the emergency stuff, obviously the radios, we can reuse. So yes, I mean, as long as I know that's the solid number, I can make it work. In working with the vendors, I'll make it happen.
And I'd like to reiterate that part of the reason we went to police is because they have more purchasing.
I cannot disagree with that at all. That is true.
Any discussion on that? Not, all in favor of the motion on the table, say aye.
Aye.
All opposed, say nay.
Nay.
Motion carried 6-1.
So just for my clarification, yes, with a cap of 60.
Right.
Okay, thank you very much.
Thank you.
Thank you for your patience.
No problem.
It was on its own speed.
Yeah. I'd like to comment on, I supported that because the numbers made it work, but we spent an awful lot of time talking about leasing vehicles, and at some point, we have to make decisions and stick with them. So I asked that during budget process, we also look at the lease versus buy and do some homework with Rio and so we don't have this discussion every time we need a car.
All right, action item number 2, which is family court for the annual child care fund plan budget. I believe what was requested last week, we didn't get those packets.
Fund 292 is the one to focus primarily on. 296 is a supplement, and that's the one that I'll be working with Cameron on untangling those funds a bit. But 292 is the child care fund budget for, it's a budget status report for that fund.
I move that Leelanau County Board of Commissioners approve of the Child Care Fund annual plan and budget of amount of $875,910 for Leelanau County fiscal year October 1 through September 30, 2027.
Second.
Order discussion, Mr. Wessel.
Yeah, I was the one that raised a concern about this last week, and it was more about process than anything. I asked our court administrator for budget information, and he said I can't provide that. And I think when department heads or the court administrator comes to this body and asks for $850,000 commitment, we ought to be prepared for some questions. I was also a little taken back as he left here and said, I didn't come here to tutor the board. I've been on this board for 12 years. I've supported the court, but it's legitimate to ask the court administrator or anybody coming to this board of commissioners for a budget item it's legitimate to ask some questions. Now, I looked at the report that came, and last year we budgeted $855,000. We're 2/3 of the year of the way done with their fiscal year, and we have $413,000 left. I think it's a legitimate question to ask, do we really need to commit $850,000, which in our general fund budget is $277,000? And I don't know that we got an answer last week, and I was hoping that Mr. Clark would be here again tonight, because I think it's a legitimate concern. And it's not a concern, do I support the court? I was at a coffee hour with the judge last week, and I raved about the family court program with Cameron's program, and asked the judge to talk about it. but I think we have a responsibility to ask the questions, and I'm not convinced that we need 800 and whatever the amount is, $850,000. But I'm not prepared to vote no on that either, because we need to do it and it's gotta be submitted in August. So I'm just here to say, I'm gonna support this, but I'm unhappy with not having the information last week that we should have had. And I'm unhappy that the court administrator talked to me and said, I'm not there to tutor you. Because if I have a question, that's not tutoring, that's informing. So I will support this, but I remain concerned about it.
Any other discussion?
I would just say, you got your information? Oh, and that's what you.
After this meeting last Tuesday, I went up to the court and asked the court administrator to call me. I did not receive a call, but I did get information from Lauren.
No return call.
No return call.
Any other discussion? Commissioner Bunny?
Yeah, I know that this is always very high, you know, and it's always stated that way because it's a just in case thing. That we will get 75, if they send someone downstate and they end up there for a month, they can spend $800,000 because it's so expensive to be there. And we would get 75% of it back. But if we don't have that money in there initially, then we would have to pay 100% of whatever goes over we have in there. And that's the reason they always do this. I don't know that they need to raise it that much. And I can remember when it was 500,000, tell you the truth, but it just keeps going up. But whatever is left goes back into our general fund. So that's the only benefit I see out of it. And but I did not like that.
And it does come off the total that we budget for this year. It comes back at the end of the year, but it does reduce the options we have to fund other things. But I understand and I will support it.
All right, all those in favor of that motion say aye.
Aye.
All opposed say nay. Motion carried 7-0. Next up, we're on to item number 3, which is planning project approval.
So this was, this remained on action. I brought it to you to be approved as a project. The 2 estimates on their own were under the threshold of the signing authority of the administrator, but it was my recommendation, and as well as planning director Gail Meyer, to treat this as a project. This had been an ongoing issue at the Cedar Recycling Center, kind of their request, and after a couple of years of planning this, to install a fence and do striping at the recycling center here.
Commissioner Wessel?
Yes, I move that the Board of Commissioners approve the Solon Township Recycling Site Project in the amount of $5,864 with funds to come from the Recycling Fund Capital Outlay Account ending in .970.000.
Support.
Supported, discussion? Commissioner Robbins?
I think I was the one that voted against this, and the reason I did was, for one, maybe you can answer, if it's under 5,000, it never needed to even come in front of us.
It was 2 invoices or estimates, the fencing being the larger one at around $4,800, I believe, and then the striping brought it over that 5,000. The thought was to treat this as a project. It could be designated as a project and completed that way. So that was our choice to bring that before you for your approval.
Okay, I did reach out to Dwayne, and we had a good discussion, and how it was presented to me was the striping is actually going to be free. He said, well, I'm going to work with us on that. There's probably not going to be charged. And the fencing was, that it wasn't explained to us last week. That was the only person that even wanted to do the fence. And I guess my defense back to Wayne was, I trust you, but it looks a lot better to us, looks a lot better to them. Bring the, the shooter last week said, hey, I don't know who it was, Apple Fence or who it was, said they're willing to do it. Here's the receipt. Molan's going to do it free. I mean, this is stuff I think if it's presented right up front, it'd be a lot better for everybody here. So, I mean, we worked it out and everything. I'm gonna vote for it, but that's what I would like to see where I sit is, you know, not just throw numbers or just, you know, it's not that we don't trust you, but, you know.
I didn't know that Molon was gonna do it for free. I presented 2 estimates, one for striping and
But
one
put
for
it Dwayne,
fencing.
I mean, you can talk to him, but he said, yeah, they're gonna probably just, you know, they do a lot of our striping and they didn't have a problem probably doing it free. So.
You're okay, Bob?
I do like when there is a gray area as far as whether a project or some spending could or could not come before this board, that it does come before this board. And I also appreciate that it comes with 2 yes votes, as Commissioner Wessel signed the application about 3 years ago, and you were all over the minutes from when you were a Solon Township trustee. So you guys should be very familiar with it.
I'm very familiar with this, and a lot of it, yeah, I was on my time in the township board there when this came up. And I remember Trudy Gallo coming there and agreed to do a lot of this, so I'm glad to see that the county is moving in that direction of fulfilling, yeah, funding's there and fulfilling that contract there, so. All right, to all those in favor of the motion, say aye.
Aye.
All opposed, say nay. Motion carried 7-0. Next up, we have senior services, item number 8, which is request to issue requests for issue proposals and home site despite another care. Mr. Algar?
I propose that the Leelanau County Board of Commissioners authorize issuance of an RFP soliciting proposals to provide homemaking, personal care, respite, medication management, quick care, and medical transportation to eligible Leelanau County older adults.
Supported, discussion? Mr. Money?
Yeah, I have voted against this last week and I will again this week because I do not believe that these are the only people that can do these, whether it's medication management or foot care or whatever. I just think that, that we need to make sure, well, actually, these are the ones that are going out for.
Yeah.
Yeah.
I'm sorry.
Specific vote.
You like this one?
Yeah, it's the next one. You're right. I'm sorry.
Okay, all in favor of that motion, say aye.
Aye.
Opposed, say nay. Motion carried 7-0. Next, we have the request to waive bid policy for contractual services. So, Mr. Algar?
I propose that the Leelanau County Board of Commissioners authorize to waive the board policy on competitive bid process for the Leelanau County Family Coordinating Council for the laundry project services, Catholic Human Services for the Senior Companion Program, Health Department of Northwest Michigan for dental care services, Share Care of Leelanau for their volunteer coordination, transportation and wellness programming, and Northwest Michigan Community Action Agency for the Meals on Wheels program.
Support.
I'd like to comment on that. Being on 2 boards that are involved in these services, these are the people who do it, and they do it free practically. So there's no competitive bidding. Share Care is volunteers who drive people to things. You're not going to get anybody cheaper than a volunteer. Laundry project, that is a compassion project that's been going on for years. That's partially funded by a very generous person in their will, and gets some support, etc. And I'm sorry, Gabby.
Thank you. You've said it clearly. Just to give one other potential for meals in the county, area agency gets Older American Act dollars. The OAA funds part of the area agency. And so through their waiver program, they're able to contract with Mom's Meals. But that's specific to OAA funding, which we do not receive. That's specific to Advantage plans, insurance plans. So if somebody doesn't want Meals on Wheels and they have a Advantage plan that covers to pay for Mom's Meals, then that's an option that they have as well. If they are eligible to be a part of the waiver program through area agency or PACE or whomever, they have other choices out there other than Meals on Wheels. So that's just one example of another opportunity that the funding really isn't there to provide for the whole entire county.
I'm not against any of these programs. I'm against us not ever going out for bids. These are just given.
Then what
Yeah.
happens if they don't respond to the RFP? Do we just go without, not negotiate?
If they don't respond to it, then I guess that's what you do.
Mr. Wessel?
Yeah, I used to be involved in a laundry project and it happens in Suttons Bay and the cost to that program is the laundromat itself provides the washers, the dryers and the detergent. But the laundromat itself is filled with volunteers and social workers and nurses and counselors working with these people in there at the same time they're getting the laundry. It's just a marvelous, there's no other agency in the area that provides that service. We're not contracting out for laundry services. We're contracting out about what happens at the laundry project. So there is really a difference.
And there's nobody here making money. Nobody's making a profit.
Commissioner Robinson?
This is all volunteer.
Again, we talked about the cars and how we want to keep everything local. This is a perfect example here. We only have one laundromat in the county. And I think you go into Traverse City, you don't find many laundromats anymore. I think the closest one may be Tom's 14th Street. I don't even know if that's still there, but it's right here in our backyard. I mean, it's probably the best committee I sit on is your committee there. It's in the wintertime when we give the shared gifts, or what do you call them there? We go into these people's houses and see what little they have that we take for granted every day. And a smile on their face, and it's just, they share care of the laundry and all that. I mean, the only alternative I can see here, to save is, let's send them down to Bellinger Creek and give them some soap and they can wash through the stones like they did in Stone Age.
Any other discussion?
I just say we don't really have any other even financially viable option for that laundromat. It's virtually paid for by a donation from the Eggers years ago. And I was talking to Mary Stanton, and I think out of the cost of $12,000, they pay $10,000 out of the money that they have. So this isn't really costing us anything. This isn't really this is a privately funded project that goes through your office mostly.
We do have a contract for about $2,000 that we put towards the laundry project.
Right.
So if the need is there, in 27, Sharon and I will discuss, and maybe 2027, you don't see that $2,000 come out of our budget. Maybe the need isn't there because they have enough in the private funds, but
they pay the overwhelming majority of all.
Absolutely, they do.
All right, all those in favor of that motion say aye.
Aye.
All opposed say nay.
Thank you.
Thank you, Lena. All right, next up, we have administration, acceptance of a couple 2% grants.
Yeah, so the 2% award letters were received just after the executive last week. And the ceremony for the check acceptance is July 28th. So the window to present this to you for acceptance was quite tight. So thank you for your understanding for the late addition. As you will see itemized, we applied for 5 and we were awarded for 5A. The request was for $14,000 for 5 loads 2 fish, and that was funded in full. B, C, and D were partially funded. And they are before you for your consideration, and I believe the motions have already been separated.
I move that the Leelanau County Board of Commissioners accept the 2% grant award from the Grand Traverse Band of Ottawa and Chippewa Indians in the amount of $14,000 for the 5 loaves 2 fish protein supplement program. With thanks.
Support. Moved and supported, discussion. Mr. Money?
Yeah, I just like to say that, if you look at these things, 80% of the county's casino property taxes are being donated to nonprofits and charities. It is illegal for government to donate or loan money. So I just wonder, I mean, I was at the firefighters meeting, fire chiefs meeting, and they talked about 2% funding. They have never been denied their money, but they only ask for things that work for the fire departments. You know, so I just wonder how many libraries in Leelanau County, how many villages in Leelanau County, how many townships or fire departments do not receive their request, because 80% of our funds that we're asking for their casino property tax are going to nonprofits and charities.
Any other discussion? Not, all in favor of that motion, say aye.
Aye.
All opposed, say nay.
Nay.
Motion carried 6-1. Next, the next motion. Commissioner Wessel?
I move to accept the $2,000 Grand Traverse Band grant for MNC's Education Association Education Center build.
Support.
Supported, discussion, Commissioner Bunny?
Yeah, I'd just like to read the terms from the consent agreement that was settled, the tribes versus Engler. The Grand Traverse Band of Ottawa and Chippewa Indians has defined in the stipulation, it has agreed to pay 2% in video games revenues to local units of government. This is right from their application. It says, that is local townships, villages, cities, county board of commissioners, and public school systems. There's nothing in their application that says it should go to nonprofits or charities.
All right, any other discussion? Not, all in favor of that motion, say aye.
Aye.
All opposed, say nay.
Nay.
Motion carried 5-2. Next motion on the Parks and Rec Building project.
I would move that the Leelanau County Board of Commissioners accept the $2,000 2% grant on behalf of, for the Parks and Recreation Pavilion project at Browning Valley Park.
Support.
Supported, discussion? Not, all in favor of the motion, say aye.
Aye.
All opposed, say nay. Motion carried 7-0. And then the final one for the BOC visual upgrade project. Mr. Wessel?
I move to approve the $2,000 Grant Travers grant award toward the BOC audiovisual upgrade project.
Support.
Supported, discussion? Mr. Money?
Yeah, this is the type of stuff that the casino's property tax is supposed to be spent on. This and the park and rec, not the what we've spent 80% of our funds on.
Any discussion? Commissioner Robbins?
Just a question on this 2,000, is that just the whole project's going to cost 2,000 or it's just applied?
It's just what they gave towards our project.
The
It's a lot more
application
than that.
for this specific application, the total amount, we've only received one estimate and the BOC has approved the issuance of a request for proposals for this project. The one estimate that was received was for about $48,000.
Let's just go towards that, I guess. All in favor of the motion, say aye.
Aye.
Opposed, say nay. Motion carried 7-0. Do we want to move public comment up before our closed session? Public comment? Okay.
I would like to take a break there.
Well, why don't we go into closed session and we'll take some time to go in there.
I move to
Instead of coming
enter,
back here.
I move to enter closed session to discuss written attorney-client privilege. Legal opinion dated July 21st, 2026, from the county's corporate counsel pursuant to MCL 15-26818.
Supported, do a roll call.
Commissioner Campbell,
Yes.
Commissioner Robbins,
Yes.
Commissioner Walter,
Yes.
Commissioner Wessel,
Yes.
Chairman Yoder,
Yes.
Commissioner Alguier,
Yes.
Commissioner Bonnet.
Yes.
7-0.
Thank you. Take a quick break before we meet everybody in there.
I need.
You ready? We got a motion to take open session. Ready? Supported. All those in favor of that motion say aye.
Aye.
Opposed, say nay. Carried 7-0. Mr. Walter.
I move that the Board of Commissioners reject the counteroffer dated July 17, 2026 regarding the proposed separation agreement and authorize the corporate counsel to continue negotiations consistent with the parameters discussed by the board in closed session. I further move that the board chair be authorized to execute, sorry, can't read, can't talk, a separation agreement that is consistent with those parameters and approved as through the form by the county corporation council.
Support. Supported. All those, is that a roll call?
If you wanted to be, I didn't know.
All in favor of that motion say aye.
Aye.
All opposed say nay. Motion carries 7-0. That review of financials. Mr. Money?
Yeah, I just had, in the late, on page 8, there was a dog that we paid for care. I don't understand why we're paying for some dog's care at the animal hospital.
Sure, that wasn't just senior services.
I don't know, I mean, it didn't say anything like that, it just said, to the animal control officer. So I didn't think it was through senior services. So I would like us to look into that, find out why we're paying for dog care.
I can certainly inquire and see if there's additional documentation for that.
Which I appreciate. And that and everything, they already answered it about all the other things that were going on.
Any other questions on financials? Not special reports. Seeing none, public comments. 5 minutes. Anybody that wishes to give public comment? Mr. Mikowski?
Good evening. First of all, we agree with Commissioner Bonnick about PILT. The money that comes from the tribe belongs to government. I've read those documents also. Why we're trying to play games with ourselves because we want to feel good is beyond my understanding. We came across a very strange peculiarity. We had a county board of public works. And anything that has to be put in the ground in the county of any infrastructure has to be handled by the board of public works. Every sewer project, everything else has to be handled. The meeting, the board of public works consisted of all the county commissioners. County road commissioners. In 2023, early 2023, that was changed. It included the new Board of Public Works, included the treasurer, the drain commissioner, and all county commissioners. Some of you may remember that. 2 meetings were held after that, and everything went dead. We still have an outstanding project at the county in which the full faith and credit has been pledged of the county properties. And you probably hold a deed to that Northport, Leelanau Township sewer project. The county has to hold the deed until the bonds are paid off. So one wonders why all the silence and all the lack of need, because the last Board of Public Works meeting had a lot of discussion about the problems with the project in Northport, but
but apparently it's not important anymore. The Board of Public Works is now dead. And it's providing no function at all. And we never understood the reason why it was changed. So we could probably neglect it for a few more years and let just go. But again, under Michigan law, any project that goes in the ground of that structure, particularly when bonds are sold by the county Board of Public Works must be involved. Then finally, missing from the agenda again today was the fact that the apology resolution, clerk clothing policy, apology resolution has not yet come forward. We believe that it's extremely important under these current conditions where for the last 5 years, things have been quite corrupted by the way the governance has occurred by the county commissioners. That apology resolution is important, particularly during these current times at this moment, particularly the closed session matter. So we again would urge you that this apology resolution to the clerk and the financial staff, to the taxpayers for wasting over $1 million, and to the employees for messing up the morale in this county building. Thank you.
Any other public comment? Mr. White? Also, I'm hearing a lot of static. Just make sure your phone's not up.
Good evening, Commissioners. Jim White here again. Just wanted to let you know that, as you can tell, we have some people here sitting behind me who are eagerly awaiting some announcement from this board. Wasn't exactly what we were hoping for as a group, but it seems like you're making progress, and we'd like to encourage you on that path. The one thing I will say is that I didn't have any experience as a public manager, but I did have a lot of experience as a corporate manager. And when it came time to end somebody's employment, it didn't take long. I've delivered the message and I've received the message in those situations, and it was cut and dried and quick. And the quicker it happened, the better it was for the organization, both for the person who was departing and the people who were staying. I would hope that you guys are doing what you can to make sure that this process doesn't linger any longer than necessary, because it is extremely excruciating for everybody who's waiting for the results. I can't imagine what it's like for the people who work here, not to mention yourselves. So the faster you get this done, the better. Thanks for taking the time to make a good decision, but just don't drag it out any longer than you have to. Thanks.
Any other public comment? Mr. Weiser?
Bill Wiesner, Elmwood Township. And just again, for no fraud, we got to get rid of the machines, go back to one person, one ballot, one vote, one day. And if we've had machines for a long time, we still need to get back there. There's no way to assure honest elections without doing that. And this handout that I gave, there's 4 articles, 4 different things to look at there. The first one is from Dr. Frank, and it's about logic and accuracy test. Actually, I gave it to Michelle yesterday at the logic and accuracy test. And Dr. Frank says, makes 2 statements. He says, number 1, every programmer understands that they can make software behave differently on different days with a single line of code. And the second point he made is every IT person understands that whenever someone puts any kind of portable media like thumb drive into a device, it can reprogram the device. So he suggested that I ask the logic and accuracy test testers these questions. Number 1, do you perform logic and accuracy tests randomly throughout the election or just before and after? And it's just before is what they said. And then, so it can act differently after the test is what the point Dr. Frank's making. And the second thing, do you have portable media to transfer anything into the machines? And Michelle, I asked her that, and she said, no, we don't. But I do remember being here when Michelle was debating on the election night whether or not they would use some kind of transfer for just going from the townships, or if she was going to have them carry it up, possibly with a USB drive. I don't know how it does. But see, the internet is just one of the things online. There's different ways to be online, from what I've heard, and any one of them, if you can have any of those systems, it can transfer to the other one. So you can't be online at all. The second article is Trump is right about voting machines. And if you doubt that, just ask Obama appointed judge Amy Totenberg, who, by the way, is a sister to Nina Totenberg from NPR. So she's quite liberal, if you like her sister. And here's some of the experts. This was October of 2020, before the election. And she found she didn't trust the systems at all. But she decided it's too close to the elections. It would be too disarming. And so she just had to have them go ahead. Read those quotes in there. She says both the QR code recording of the votes and the text summary of ballot selections are subject to being accessed and manipulated through hacking. And she goes on with stronger words there. The third article is the one from Mark Cook. It's called Cabal Tactics. If you go online, handcountroadshow.com, and go to learn more and go to his articles, it's 32 pages of way it's acting like a cabal to promote this corruption in the elections. And the fourth one is the one I've turned in before, and it's the parallel lockstep motion. This is Solomon, Ed Solomon, and that's the chart. The elections by the cast vote record should look like a straight line there. It's like tossing a coin. You get a straight line, relatively speaking. It should be within these parameters, or it's fraudulent. They end up looking like cast vote records way outside here. And this is the results you get. You get skewed results for sure. So just a quick summary of it is on, if you look at page 3, I've made 4 points. The first one is Ed Solomon. Here's a quote. I don't even have to explain to you why it's impossible. So let's just look at the picture. There's the picture. Does this look like a straight line? It's on your page 3. No, it's going up and down and up and down. And it's Democrats on the top part of the wave and Republicans or vice versa on the bottom, but they go in unison. It should be 2 straight lines. They average out after the coin toss averages out quickly. It might vary quite a bit at the beginning, but then it's kind of straight line. These are waves going up and down. And not only that, they shouldn't be doing the up and down, but they're going in unison. Democrats to Republicans. It's parallel lockstep motion. I'm out of time. Please look this over. We can't trust those logic and accuracy tests or anything with the elections. Thanks.
Thank you. Any other public comment? Seeing none. Mr. Comments?
I would just ask Lauren if either you or Leo might address the concerns from Mrs. Kiesel on the credit card, just to drop an explanation hopefully.
Would you be comfortable if I did that in writing, and then that could be made available, then I can have all the dates exactly correct?
Sure, or you can just send it, well, if you could also address it with Jim, with us too, or you could, here.
The undersheriff and I have had several in-person conversations about it, and the credit card was paid. I will have to double check on whether the payment has cleared, and I can do that with the treasurer's office. But he and I have been discussing it for about a week and a half. So my understanding is that he knows that the late fee is going to be covered by administration's budget, and he is going to inquire as to whether the closing date on his statements can be changed, because right now the way that they fall is about either on the executive or the day after, which means it will always be in late, or we would possibly have the option of running it as a Friday. And he's always quite diligent about getting his statements printed into finance really quickly. But in the several conversations that I've had with him in the last week and a half, it was my understanding that it was resolved.
Well,
But I
if you
can put it in writing with all
Yeah,
the dates.
and then we got an explanation and we can get it on the record.
Of course.
Thank you.
Mr. Robbins?
I just, Mr. Campbell kind of addressed a lot of things I wanted to. It's just the one, I'm not gonna speak for the rest of you, but I apologize to Mrs. Kiesel. I mean, it's bad enough when we gotta deal with our staff, but when it gets into their own household, yeah, she's right. It's embarrassment. It's embarrassment to this board, this whole county here, and we can't make sure this doesn't happen again. Because I've been following it for 2 weeks and, you know, I've been told that it was paid and then it wasn't, and I was told that, you know, that Jim was told that it was bank's fault, so, you know, stop passing the buck, let's just pay our bills and let's move forward.
Any other commissioner comments? All right, seeing none, approval of financials. Mr. Money?
I move that we approve the fund transfer number 26003.
Support.
Moved and supported. All those in favor of the motion say aye.
Aye.
All opposed say nay. Carried 7-0. Mr. Money?
I move to approve claims and accounts for $361,263.67.
Supported. All those in favor of the motion say aye.
Aye.
All opposed say nay. Carried 7-0. Mr.
I
Money?
move to approve post audit $1,818,350.48.
Support. Supported. All those in favor of the motion say aye.
Aye.
Opposed say nay. Carried 7-0. With that, we're adjourned.